So lastly, and again, I have a half-an-hour video on how to do a brief behavioral intervention. This is what you guys do in terms of people with hazardous use and some people with harmful use when you're telling somebody they need to drink less. And all that brief behavioral intervention is, it's a way of giving advice that makes it more likely that somebody's going to listen. So anyone who gives advice to anybody else can use this. It's not like a fancy counseling technique. And the idea is to aim to to just reduce the harm and get that potential problem a little bit more manageable. So the brief behavioral intervention has got 6 components, which we call frames, the FRAEMES. And that just tells you in terms of what belongs under BBIs. And the big thing is it's a feedback that you are giving to the patient. And what you're doing is you're saying to the patient, this is going on in your life, what is wrong, whether it's a physical complaint or a social or whatever their problem is, and you link it directly to the alcohol use or whatever the issue is you're going to address. You're going to do the interview in such a way that the responsibility to manage it gets handed over to the patient, and you as the doctor are the one giving them advice to stop. You are basically coming very clearly, this is the change that I want you to make, but my patient is going to take responsibility for that change. You're going to give them lots of options and help of how they want to do it, but they're going to choose in terms of how they want to make that change. And your whole style is very empathic. I'm just here to give you feedback on something that's happened, and I want to support you through this process. And during this process, we are cheerleaders. We are optimistically empowering our patient. Our focus is not on being, oh my goodness, why didn't you manage? Or, you know, you're trying to actually, you can do this and we're going to help you actually get there. So all of you know the stages of change. I don't think I need to spend a lot of time on this. You've all done this at university. So just to remember, when people go through change, it doesn't just happen from today, oh, I need to stop drinking less, and tomorrow you've implemented it. People go through different phases when they try and bring in a new change. Pre-contemplation is when we haven't yet considered making a change. So that's an important part of a user doctor, is informing the patient of why the change is necessary. Contemplation is thinking, oh, I probably should cut down. Merely being able to visualize them, especially like a positive picture of why they need to change. Preparation is motivation. This is where you bring your menu. Let's make a plan on how to do this. This is, you know, the goals we're going to set. Action is when you get onto the plan, and now you as a doctor is helping them figure out what might trip them up. And then maintenance is this continuous safety net where we try and prevent relapse. So ideally, patients enter by pre-contemplation, and at maintenance might end up just being on maintenance. And if they relapse, then you sort of start that cycle again. The stages of change is important because when you set your goal, you want to know where your patient is. And all you're trying to do is move them on from one stage to the next. So you're not going to go straight from pre-contemplation to action. You're going to just try and move them through these steps. So we do a brief intervention in something called the 5 A's, and I will send to you guys down today like a PDF with the 5 A's written out on. And it's a little step that you can do, and you can do it in less than 10 minutes. Ask the students. We role play this quite often. Your first step basically is just asking first the patient permission. Can I chat to you about it? And this is when you now do your cage, your tweak, your assist, and you just get an idea of what's going on. Have they tried to stop before? How do they think about their alcohol use, and get and take a history? Once you've done that, now you're going to do this thing of linking whatever's going on in their life that's negative to this particular behavior. And you're going to start creating a vision, and you don't want to focus too much on the risks 20 years from now. You want to focus on how their lives are going to improve now if we make this change. And through that, you're going to try and figure out, well, what does my patient think about this? Assess means now being able to figure out how ready they are for change. And there's 2 questions you want to ask to figure out how ready somebody is for change. How important is it for you to stop drinking on a scale from 1 to 10? And how ready are you to stop drinking on a scale from 1 to 10 in terms of how able do you think you are to be able to do this? So for some patients might go, I really want to stop, but I don't think, you know, my life at the moment, I don't think I've got what it takes. Assist, very simple, is now when you discuss your goal. So you can actually sit with the patient and go with them, well, you can do this, you can do that. What do you want to do? Write it all down. And then also, refer to other support as necessary. We don't really have very good group therapy options. You might use a social worker if social issues are an issue, but our occupational therapy does do work with substance dependence, so please remember them. And then if you are not going to refer them to somebody else, so say it's just somebody who's on hazardous use or they're harmful use at the level where you're just going to see if together you guys are going to try and work, get them to reduce that amount. Try and bring them back to yourself, especially if you're in a district hospital. Bring them back on a day that you know that they're going to be there. Write down those goals, set a specific date on where you're going to follow up on that goals, and preferably give them some written material as well. Some patients you don't want to do BBIs on. So if patients have been very complex and have repeatedly failed in the past, you're not going to manage on your own to get them off the alcohol. But of course, if they've got very severe use and lots of other mental health conditions, then you also want to make sure you get somebody else involved. So in summary, please start becoming aware of just screening patients generally in terms of their alcohol use. Ask questions, do your cage, write down your number of units. If patients are using too much, remember to classify them harmful, hazardous, harmful, or dependence, and then use your brief behavioral interventions to give them advice and start seeing if you can get them to start either reducing alcohol use or at least engaging with a service that can help them with that. That is some of the references that I've used, mostly EML and DSM-5. Thank you very much.